Hi, I'm Rick Proctor, Clinical Education Consultant for DJO Chattanooga. Welcome to the Chattanooga Clinical Education Show Me series. Today I'm going to show you how to use interferential and premodulated to treat acute and chronic pain. Interferential current is a two-channel middle frequency unit, and when we cross the two currents, we get an interferential or an interference wave at the point or at the treatment site. The premodulated current is using one channel where we create the interference waveform in the machine and then we place it in the body. This gives us a larger treatment area and we do it with 2 electrodes. Now, let's get started and show you how to treat the low back using interferential. Now, the first thing we'll need to do is prep the patient's skin. So we'll expose the back, we'll take a warm washcloth and we'll actually wipe the skin and prep the area to remove any excess oils or skin that's in the area. We will then place the electrodes on the skin. Remember, with interferential, we want to do this in a crossing pattern. So since we're treating the whole low back, we're going to put 4 electrodes on the patient. The next thing we'll need to do is plug up the lead wires. And again, as we use the channels, we want to make sure we cross them. So we'll take one channel, and then we will take the second channel, again, so that the 2 channels are crossing. Now, let's turn the machine on and get started. First thing we want to do is we want to press the electrotherapy key. Then we press the interferential key. And now we want to edit the parameters to get our correct therapeutic effect, so we press the edit key. The first parameter that appears is the sweep. This modulates the frequency. Modulation prevents accommodation and therefore reduces the amount of times that we have to turn the unit up so that the patient feels the current. If we turn the sweep off, then the frequency is fixed. For our purposes, we want to have the sweep on. Then we look at the next frequency and we will see that there is a low number of 80 and a high number of 150. This is a gate theory protocol. If we wanted to do an opiate release protocol to treat pain, we would set the numbers, the low number at 1, the high number at 10. For our purposes, we're going to use a gate theory protocol and leave it at 80 to 150. The next adjustable parameters then is the vector scan. Where the 2 channels cross, they create an interference wave. They will cross at the point of least resistance. If the vector scan is off, the patient will feel that at one particular area. If we want to change the patient feel, we have the ability to change the vector scan to manual, and we can then adjust the output of the 2 channels so that we can actually change the feel or change where the therapeutic area is. The next thing we can do with vector scan is that we can make it an automatic modulation. Again, modulation is important to prevent that patient accommodation, so we can now automatically modulate the amplitude by 40% of the total, or we can modulate it to 100% of the total. For our patient comfort and safety today, we're going to modulate at 100%. The next thing that we have to adjust is the carrier frequency. 4,000 carrier frequency is typically used for a gate theory protocol. 5,000 would be used for a nerve block. 2,500 would be used for our opiate release. In this case, we're going to do the gate theory, so we're going to leave it at 4,000. The next parameter then is constant current versus constant voltage. Since we're using a continuous duty cycle, what we want to do is keep this on constant voltage. Again, for comfort of our patient. The last adjustable parameter is treatment time, and treatment time typically for a gate theory protocol will be around 20 minutes. Now let's turn up the amplitude. We will turn up the amplitude until the patient feels the current. Once the patient feels the current, we will note that spot and then just turn it up slightly more. For a gate theory protocol, we want a strong sensory feel. For an opiate release protocol, we would want a slight motor twitch. For a nerve block protocol, again, we would want a strong sensory feel. Once we have that strong sensory feel, we will press the start key and the treatment begins. With the Vectorgenesis, you have the ability to save 200 protocols that can be retrieved at a later time. In order to save protocols, the first thing we'll do is press the electrotherapy key, then we'll press the interferential key, then the edit key, and we will adjust our parameters. Let's create an opiate release protocol. In this case, we'll press the 80 for the low number, and we will reduce that number all the way to 1. Press the enter key, then we will press the 150 key. We will now lower the rate to 10. Once we get to 10, we press the enter key. We now have created the opiate release frequency. We want the vector scan at 100% for patient comfort. We're going to change the carrier frequency to 2500. We will set it at constant voltage, and the treatment time we will now change to 30 minutes. In order to save this protocol, we now want to press the folder key. Once we press the folder key, we're going to type in the name of the protocol. We're going to name this one IFC opiate. We will take the cursor, place it over the letter, and then we will press the enter key. So we'll go over the I, then the F, then the C. Right before the A is the space key, so we will hit enter for a space. At this point, we will now hit the O for opiate, and we will again type in the word opiate. Once we've got the name, we press the save key, and the protocol is now saved to the unit. In order to retrieve the protocol, from the home page, we will press the folder key. We will then press the user protocols key. We will highlight the protocol IFC opiate, press enter, the protocol will appear, and we can now begin the treatment. Now let's demonstrate how to use the premodulated waveform to treat pain in our patient's knee. For irregular areas or smaller areas where it's difficult to place 4 electrodes to get the interferential effect, we can now use premodulated. Premodulated only requires 2 electrodes and 1 channel. At this point, we want to prep our patient's skin with our warm washcloth in the water to remove any excess oils. We then want to take our electrodes. We're going to place on either side of the knee. And now we're going to take the lead wires from channel 1 and plug those into the electrodes. Now let's press the electrotherapy key, then we'll press the Premod key, then we'll press the edit key to change our parameters. The first parameter sweep is set at on, that's where we want it to be. Our frequency is set at 80 and 150. We'll leave that there since we're going to use a gate theory protocol to treat this knee pain. The cycle time will be continuous and will be set on constant voltage. Since it is continuous, and that will create a more comfortable treatment for our patient. Our treatment time is now 20 minutes. At this point, we'll turn up our amplitude until the patient feels it. Once they feel the current, we will then turn it up to a strong sensory feel. We will press the start key. And then I like to have the patient move the part at this time, just gently bend the knee and then straighten, just some heel drags on the table. This will give us a little better outcome and will help us have longer lasting effects for our treatment. We hope you've enjoyed this tutorial on how to use interferential and premodulated current to treat acute and chronic pain with your Vectrogenesis unit.